Calgary-South, followed by Cardston Taper-Warner.
Thank you, Mr. Speaker. As a registered advanced care paramedic and MLA for Calgary-South, I hear from Albertans that there isn't adequate access to ground ambulance. I hear they're waiting longer for ambulances to arrive at their home, and when transported to the hospital, patients are waiting needlessly in the hallways before they receive care from nurses and physicians. To the Minister of Health, how will your announcement this week on ground ambulances lead to tangible changes in how Albertans access ground ambulance and receive further care in the system?
Honourable Minister.
Well, Mr. Speaker, that is an excellent question, and as the House knows, the Health Quality Council of Alberta recently completed a year-long review of ground ambulance service across the province. What they told us very clearly, Mr. Speaker, is that we are correct in believing that EMS is health care and that we need to complete the very elaborate plan that we have put in place to get us to the point where all ground ambulance services function as an integral, central first point of contact in our healthcare system.
Honourable Member.
Thank you, Mr. Speaker. I was born and raised in the city, but I started my career in rural EMS. And the decision to resume consolidation of EMS dispatch operations from 15 to 3, how is this going to impact the rural dispatch centres? Can the Minister assure rural Albertans that there will continue to be reliable dispatch service for ambulances in rural Alberta?
Honourable Minister.
Mr. Speaker, we certainly can assure Albertans that through the consolidation of dispatch across the province, we can provide better ambulance service. The reason for that, Mr. Speaker, is it gives us the opportunity to manage all ground ambulance services as one fleet. When an ambulance is called out of a given community to assist in another community, we can arrange for appropriate backup. The system also allows us to ensure that the rural ambulance, if that happens to be the case, is able to return home as quickly as possible. So, Mr. Speaker, this is a job that was started a while back that needs to be completed. The report provides a roadmap for that, and we're committed to finishing.
Honourable Member.
Thank you, Mr. Speaker. As a private member, I have a responsibility to ask questions for my members of Calgary-South and my fellow paramedics. And I hear a number of times that ambulances are tied up transferring patients with non-urgent medical concerns. And in fact, I've experienced that. Will the Minister be exploring all options that will appropriately use inter-facility transport units for non-emergent transports and allow emergent ground ambulances to respond to the critically ill?
Honourable Minister.
Yes, Mr. Speaker, and that is in fact an issue that was not specifically referred to the Health Quality Council, but one which I have directed Alberta Health Services to explore. Mr. Speaker, in our growing population across the province, we see communities that are seeing increasing demands in both hospital services and for ground ambulance. We need to make sure that our best equipment and our most highly trained personnel are available at all times to serve those who are most in need, most critically ill. And, Mr. Speaker, there are options available that AHS will be bringing forward to make sure we do not use those resources for non-urgent situations.